Hi there. I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible: 7 Keys to Defy the Odds. And today I'm going to talk about high blood pressure and the possible side effects of having high blood pressure and why you don't want to just let it be. And two, what functional medicine can do to help support you when you have high blood pressure. And high blood pressure is something that should always be paid attention to because it can cause long term damage. It can cause long term damage to your heart, to your brain, to your kidneys. It can cause problems with your eyes. When you have high blood pressure, the blood vessels get stiffer and it's harder for them to push circulation through your body. So you want to make sure that you actually manage it. But functional medicine looks to find the root cause of the problem and to possibly address that. And over the years that I've been in practice, I've helped with literally hundreds of patients who have high blood pressure find better balance. They still sometimes need to take medication, and so medication is often the first line of treatment just to help manage it until you figure out what is the root cause. And there are many different kinds of medication, and some of those medications are actually potentially helpful to help support and protect your kidneys, to help support and protect your brain. I recently had a patient who had a stroke, or he had a transient ischemic attack because of his high blood pressure. And he wasn't that old, he was in his 50s. And I want to help support people so that they don't get to that situation because of not getting the right medications or not getting the right support. And sometimes you could be on 3 to 4 to 5 medications and still have high blood pressure because the underlying root cause has not been addressed. So I'm going to talk about the possible underlying root causes. First of all, there is blood sugar management. And so blood sugar is a problem for so many people. And you want to make sure that you eat a relatively low carbohydrate diet and keep your blood sugar at a reasonable level. There's a diet called the DASH diet, which is commonly prescribed for hypertension. And really, what it is a high, like a Mediterranean diet, which is lots of vegetables, fruits, whole grains, and minimal carbohydrates. So especially processed foods. So many of us eat so many processed foods. I always say get rid of all the white foods, the things that are sort of like white bread, white rice, white processed foods, and so when you stay away from those foods, you're more likely to do better in so many ways, including every element of your health. The other thing that is important is inflammation in your body. So there's a test that you can do, a blood test called the C-reactive protein, or CRP. There's one called HS-CRP, which is highly sensitive CRP, and that helps see if there's inflammation in your blood vessels and actually elsewhere in your body. And when it's elevated, it means that there is inflammation. And it's a very sensitive test, meaning that it can be high for any number of reasons. So it's possible that you could have a high C-reactive protein if you had gut issues or if you have blood sugar issues, and so or an infection somewhere in your body. But having that level tested will give you information so that you can do something about it, and you can start a search to figure out, is it an infection or is there inflammation for some other reason. I also think, or there's evidence that magnesium levels are really, really important for managing blood pressure, and a high or managing blood pressure and just measuring a serum magnesium isn't always accurate. So magnesium is important for like 400 chemical reactions in your body, and so when you measure it in your serum, the the blood will steal magnesium from your cells in order to keep enough magnesium in your serum so that you can stay healthy. So what you have to do is measure how much magnesium is in your red blood cells. And when the red blood cell magnesium is low, you're more prone to high blood pressure or a bunch of other symptoms. So having the right amount of magnesium is pretty important. You can also measure other minerals. So sometimes there's a deficiency of other minerals in your blood that can make a difference in how your blood pressure is. So it's finding the right balance of all the right minerals. Also, um, uh, you want to think about heavy metals. Some of my patients have had heavy metals, and it's pretty easy to get heavy metal toxicity. Um, if you, some of my patients don't know this, but tuna fish. If you eat tuna fish every week, or even salmon, I've measured the heavy metal levels in some of my patients who say all they eat is salmon because it's supposed to be safe, but they have mercury toxicity, and heavy metal toxicity can contribute to not just hypertension but also to arrhythmias like atrial fibrillation. And so it's always important to measure heavy metals and see where they are in your blood if you have these problems. Another issue is that the kidney function may not be in balance, and so that can cause problems with your blood pressure. Also, cortisol and stress. So, what's called the hypothalamic pituitary adrenal axis. When that is out of balance, and when your cortisol levels run constantly elevated because of stress or worries or things like that, that can cause high blood pressure. So, balancing the cortisol levels is valuable and important. And you can measure all of these things. You can measure the minerals, you can measure cortisol levels, you can look for inflammation in the blood, you can look for heavy metals. And another level that I had a patient who had several heart attacks at a fairly young age. And nobody, he didn't have any of the risk factors. He had a healthy lifestyle, and he didn't have any of the risk factors, but it turned out that he had sleep apnea. So, sleep apnea is another issue that you may not be aware of. You may not know that you have trouble sleeping, or you may not be aware that you're not breathing at night. So, if all else does not show anything, get a sleep study to figure out if you have sleep apnea. All of these things put together will create a balance of information that we can then use to help support your blood pressure so that you can not have high blood pressure. And then, if you need medication after all of these things have been handled, then medication might not be four different kinds of medication. It might just be one, or you might need only a very low dose of a medication in order to support your blood pressure. I hope you found this helpful, and if you have any questions, please let me know in the comments. I look forward to hearing from you. Thank you so much. Have a wonderful day.